Um, Welcome. My name is Rebekah Wolinetz. So I'm assuming that if you are here, you are either a new mom, or maybe you're expecting, or maybe you had a baby a couple months ago and you're still not sure how to get back into working out. So regardless, welcome. Like I said, my name is Rebekah Wolinetz. I'm a physical therapist at our Lakeshore East Clinic, which is right across Maggie Daly Park downtown. And I've been treating for about 6 years. I've been with React for close to 3 years now. So majority of that time I've been treating pelvic floor conditions, pregnancy, kind of the whole spectrum. And then as well as just regular kind of orthopedic conditions, so low back pain, shoulder pain, neck pain, all of that. So a little bit about React Physical Therapy, just to give you a little background if you have not been a patient with us before. So we are a small boutique style outpatient clinic. So we have 5 locations throughout the northern suburbs in Chicagoland. At React, we focus on a whole body approach, and we really stress one-on-one patient care. So we are direct access. So that means that you don't need a referral from a physician for most insurance types, so no delay in getting treatment. And then we do offer free 15-minute free injury screens. So if you're not entirely sure of where to start, we're definitely able to help you kind of navigate different things that you might need to go to just get treatment. So I'm going to share my screen before I kind of talk anymore. If anyone has any questions or, issues hearing me, just kind of throw that out in the chat, just so that I know if someone's not able to hear me. So I'm going to share my screen. Never mind, I'm going to present my screen. All right, so I do want to just go over a little bit more about background on pelvic health therapy if you're not familiar with it. So pelvic floor therapists do take further continuing education courses to be able to kind of just further their knowledge and experience with working with women in pelvic health conditions. So some of the conditions that they treat, pregnancy, postpartum conditions, endometriosis, pelvic pain, pelvic organ prolapse, urinary incontinence, fecal incontinence, and those are just really just naming a few. Most pelvic floor therapists also are trained to do internal assessments done in private treatment rooms. So that just better gives us more information on what your pelvic floor is doing. So, is your pelvic floor weak? Is it tight? Is there a lot of tone? Do you not know how to relax it? And so we use all that information to develop a plan of care and a treatment plan. So it's not just doing Kegels the entire time. Definitely wish that it was that simple, but it's more complex than that. But it's really just making sure all your muscles are working together to create stability and support for your body. So kind of getting into, let's click there. Pregnancy itself is like running a marathon. So according to a recent study by Duke University, they found that women who are pregnant expend about 2.2 times their resting basal metabolic rate. So pregnancy is basically the longest duration, highest energy expenditure thing that a human can do. So it's definitely no wonder that you're tired during pregnancy. So, and essentially, along with running a marathon for 266 days, your body is busy changing in order to accommodate a growing fetus. So, so since you don't get taller during pregnancy, most of the tissues and joints must accommodate in order to make room for the baby. So that means your abdominal muscles stretch out. Through here, you can see that her abdominal muscles definitely are going to be elongated here. Pelvic floor gets stretched out. kind of lengthened, and both of those can lead to weakness. Your diaphragm, which is your breathing muscle, sits underneath your ribs here, right on top of that baby, no longer has that room to expand downwards. So it makes your breathing more shallow, just more difficult to get that deep breath in. And then on top of that, your ligaments change. So your ligaments become more lax or loose, and that is to be able to create space for the baby for delivery, and then just kind of holding or carrying the baby. And that will create instability in the pelvis, the lumbar spine, so that can lead to pain there. And then women also experience that passed into that postpartum period, especially if you're breastfeeding, then it'll also continue to contribute to that. Some other postural changes that you may notice, so kind of that forward head position, increased curve in your lumbar spine here, your weight kind of shifts forward. A lot of times that can cause more tightness into those calves, so if you get cramping in your calves at night, and then your ribs expand outwards. So a lot of changes, not necessarily glamorous sounding, but all definitely important in being able to create space for that baby. So regardless of, if you deliver vaginally or you have a C-section, giving birth is definitely a major traumatic event. So with the vaginal birth, you can have perineal or muscle tearing, tearing of the pelvic muscles or connective tissue. So the perineum and the pelvic floor, so perineum is basically the part where you're sitting on. So in between the urethra and the anus. So basically its role is to provide anti-gravity support to the organs, helps with closing the urinary and anal sphincters, resists any increased intra-abdominal pressure. So if you're coughing or sneezing, that increases abdominal pressure. So your pelvic floor muscles can close and kind of resist that, so you don't leak when you cough or sneeze. And then it also helps provide postural control as well. So tearing basically results in that fascial weakness, and that tearing in the muscles can alter motor control. It can cause weakness in those muscles. And then sometimes with a vaginal birth, there's also a nerve damage. So there can be either compression from the baby or kind of a stretch injury from delivery itself. So if it's a traumatic delivery, needed forceps, or had a long second stage, maybe a heavy baby, that can cause some nerve damage. And a cesarean section is not without risk either. So, aside from surgical risks, the incision made to access the uterus and the baby goes through the abdominal wall. So that means that it's going to affect the motor control and just basically almost inhibit the abdominal muscles from engaging and functioning properly. And then women who also have an emergency section, especially if they labored for a long time, will experience sometimes kind of issues from both the vaginal birth, even though you didn't have a vaginal birth, but it can have, issues from both. Some women will also experience low back or pelvic pain after delivery, and that can impact carrying, lifting, and just an overall willingness to do things. And there's also some evidence that suggests that women who do have this type of pain afterwards, there's increased risk for depression as well. So unfortunately, all of these changes don't go away overnight. It definitely takes time to recover from pregnancy and giving birth. You see all these celebrities who seem to just bounce back after having a baby, and that is definitely not the norm. I mean, those people are usually, have a trainer on hand, maybe a personal chef. So don't think that that's the normal. So you do need time for your muscles and incisions to heal. So typically anywhere from 6 to 12 weeks. You need time for pain to decrease, time to basically figure out and understand your new body. as well as rest. So, you know, not getting enough sleep, things like that, and just exhaustion from the pregnancy itself can still exist. And then, you know, you still might have some postural changes that happened from pregnancy itself. So that can lead to muscle weakness. So those abdominal muscles are still going to be elongated. They're not going to necessarily go back right away. You know, your posture while holding your baby or breastfeeding or bottle feeding can also still exaggerate that posture. So, you know, a lot of times you'll see women, or I see women who have that kind of forward posture. A lot of women who have upper back pain, low back pain, kind of pelvic pain, just resulting from that posture. So aside from recovering from pain and any tissue tears, women may experience diastasis rectus abdominis, so DRA. So during pregnancy, your belly clearly gets larger. And so that causes the linea alba, which is just white connective tissue that runs between the abdominal muscles, that rectus abdominis muscle, and it causes it to stretch. And it can stretch so much that it causes a separation of those abdominal muscles. So typically you'll notice a separation within that first 6 weeks, and that is very common to experience. But around that time is when you should notice that it's going away. So sometimes it doesn't, and that is treatable, but it's a painless condition, although it can lead to significant dysfunction, especially if there's greater than a 2 centimeter distance between the muscles. So it impairs the ability for those muscles, the abdominal muscles, to kind of talk to each other and have good motor control. And that can lead to low back pain. It can lead to urinary incontinence, constipation. And just kind of like a little tidbit. So just to kind of get a reference of how long it takes for abdominal muscles to kind of recover from pregnancy. So in women who have had a C-section, they don't, by 6 weeks, they maybe regain about 50% of that original tensile strength of the abdominal muscles. So, and then by about 6 or 7 months, maybe somewhere between 75 to 95% of you get that original tensile strength. So just kind of tells you that, you know, it's a process of healing. You're not going to just bounce back right away. It's going to take some time. So I do want to go over how to check for that diastasis rectus abdominis. So I'm going to kind of angle myself here. So hopefully you guys can see me well with this. Okay, so basically, I'm going to be on my back, and I'm going to have my feet up, so in this hook line position. And I'm going to take 3 fingers, and I'm going to place them at my belly button. And what I'm going to do is I'm going to do a curl up, just like this. So I'm taking my shoulder blades off the table as far as I can, and then back down. So as I come up, I'm looking to see how close together those abdominal muscles come around my fingers. So I might have to adjust my fingers. So as I curl up, the muscles might come around the 3 fingers, but if I leave my 3 fingers there, it may give you a false kind of measurement. So you have to allow your muscles to move as you're doing it. So you have to kind of let your fingers go, so that you might have only just a 2 finger separation. And that 2 finger separation is kind of close to that 2 centimeter distance. So usually if you have below a 2 centimeter or 2 finger difference, it's not a huge concern. I mean, really at that point, we're just concerned, you know, if your muscles are working appropriately and they're engaging well. Larger than that, that would be definitely something that you want to go for physical therapy. So if you're about 2 fingers to, I would say like maybe 3, 3.5, sometimes larger than that, you do need a surgical correction. just because that separation is just so large, and that usually happens with twins or, you know, multiples. That's usually when you see that kind of large separation. And we'll have time for questions at the end. So if there's something that's not clear about that, we can definitely go over that again. Okay. So where do you start after birth? So there's not really clear guidelines for a lot of women who give birth. So, and it, you know, it might depend on your OB, and you know, they kind of give you like a general time frame. Most women, if you had I would say like a non-traumatic vaginal birth, I would say they're clear to work out about 6 weeks after delivery. And then a cesarean birth, usually about that 8-week time. Again, you need time for incisions or tears to heal, pain to decrease. But there are benefits of exercising immediately after birth. So there's cardiovascular benefits, psychosocial effects, so less anxiety, less depression, increased feeling of energy, increased blood flow, improved intestinal motility, so getting, you know, some more normal bowel movements again, and then beginning to address any muscle imbalances that might develop during pregnancy. So in order to prevent low back pain, pelvic pain, hip pain, pelvic floor dysfunction, so urinary incontinence, or even dyspareunia, which is pain with intercourse as well. So every birth is going to be different. A lot of these suggestions that I'm going to make are, I would say, if you experienced a uncomplicated, non-traumatic vaginal birth, and some of these are okay for like a C-section as well. I would say if you had a more traumatic birth or just complicated delivery, I would definitely recommend maybe seeing like a physical therapist, or, you know, talking a little bit more with your OB or your midwife on exercises that might be appropriate for you. So in general, I would recommend that new moms start off slowly. You know, in that immediate postpartum period, these exercises should be very low impact, low intensity, with the goal of reducing pain, helping to regain motor control of the muscles, and restoring postural imbalances as well. So the one that I would always recommend to start off with is just focusing on breathing. The easiest kind of low level exercise, not really gonna hurt anything. So if you had like a tear, you know, or you had a C-section, this should just be very nice and comfortable. So again, during pregnancy, that diaphragm kind of gets stuck you know, underneath those ribs. There's not a lot of space for that diaphragm to come down. So starting off regaining that good deep breath can help to activate the deep core muscles and really just help to reduce anxiety and stress. And there's a lot of good things with diaphragmatic breathing. So I'm going to go over in maybe like a couple minutes. We'll go over some exercises, and we'll review how to do diaphragmatic breathing if you're not familiar with it. Drawing in is another safe exercise to do in that immediate postpartum period. So drawing in is basically activating your deepest abdominal muscle. It's like bracing your abdomen, essentially. Kegels, I would say, are a good exercise to bring some blood flow, just to promote healing to the pelvic floor, but I wouldn't go crazy with them. And that's only kind of my bias, just because I don't know what your pelvic floor is like. Some women have a tighter pelvic floor, and those are women who I usually don't recommend doing Kegels, just because if a muscle is already tight, we don't want to make it, you know, get any tighter, and having you contract is not necessarily going to help. But I do think, you know, doing a couple, you know, throughout the day can be beneficial, just to promote that blood flow to the muscles. Some gentle hip strengthening. We'll go over a couple exercises for that, working on those glutes, getting those inner thighs strong again, and just kind of restoring that imbalance too with those. Postnatal yoga can be also very good at this time. So I would definitely, like, if you're gonna do some yoga, I would definitely seek out, you know, a group who does that specifically, works specifically with postpartum moms, and you know, maybe just working on more that restorative yoga until you start to regain some of your abdominal control. And then low impact cardiovascular exercise. So walking is definitely a safe exercise to do. Don't want to go crazy with that either right away. You know, kind of like anything, you want to just kind of slowly get back into it and assess how you're feeling with it. So before I move on anymore, so we're going to go over some of those exercises. So I'm going to start off with diaphragmatic breathing. So diaphragmatic breathing or belly breathing. So again, you're going to be in this hook lying posture. And I like to have one hand on my chest and one hand on my stomach. So hopefully you guys can see me here. So I'm going to breathe in through my nose and I'm going to breathe out through my mouth. So as I breathe in through my nose, I'm going to try to lift my hand that's on my belly up. And then keeping my hand that's on the chest pretty much is not going to move. So we want to try to pretty much keep that right where it's at. So as I inhale, and then exhale, and then inhale, so I'm really letting that air out as I exhale. You know, maybe like a 5-second hold as I'm exhaling, nice slow inhalation, and then slow exhalation. And you can do this, you know, maybe 10 repetitions. If you feel like you need longer, maybe you've had a really stressful day, you can do it longer. You just want to do it a little bit more rhythmically and slow, just to make sure that you're not also hyperventilating. So doing the drawing in, I also like to start this off on your back. So essentially we're going to be looking at our hip bones and we're going to try to draw our hip bones in towards each other. So if I'm in this position, I like to keep my hands on the inside of my hip bones and I kind of bring my fingers deep just to feel, because this is the deepest abdominal muscle that we're trying to activate. So I don't want a lot of tension underneath my fingers as I try to draw my hip bones towards each other. So we're imagining that we're tying, maybe you have some string and you're tying your hip bones together. That's what we're trying to think about. So we're focusing on below the belly button and just drawing together. So it doesn't really look like I'm doing a whole lot. I'm getting that feedback from my fingers. So I'm using my fingers to tell me, okay, I have a little slight tensioning underneath my hand. That's how I know that I'm doing it right. If I feel a lot of tension underneath my fingers, I'm engaging too much. I'm using my obliques. We don't want to use those at this point. We want to just focus on that low level abdominal exercise, so just some gentle tensing underneath your fingers. So I should be able to have a full conversation if I need to. Basically, you just don't want to hold your breath. If you're holding your breath, you're not doing it correctly. So you're just drawing your hip bones together, not bringing your knees together, just tensing your muscles there. Okay. Some other kind of lower level, good just starting exercises. If you have a ball or you can use a pillow, you can do a little hip strengthening. So this one we can do on our backs, or we can do, sorry, let me bring this down a little bit here. We can do this on our back, or we can do it seated, maybe seated on a Swiss ball. That's good to kind of engage that core. And then as you get good at this exercise, you can combine the two, where you tense here and then squeeze the ball holding maybe 10 seconds, getting that fatigue in those inner thigh muscles. So holding for about 10 seconds. And then as you start to progress with this, you know, you can add in that inner thigh squeeze with other exercises. So maybe bridges might be a good exercise to do that in, or, you know, starting to initiate a, you know, body squats. You can always add that inner thigh squeeze as well. Another good starting exercise, safe to do in that first 6 weeks, doing a clam. So clamshell, it's a good hip exercise. So I'm here, I'm be on my side. My knees are going to be slightly bent. I'm keeping my pelvis kind of stacked, my hips stacked on top of each other, and then I'm going to lift at that top knee. So I'm keeping my ankles together, I'm lifting my top knee, so I'm squeezing my glute, and that's where I should feel that. You can do this without a band or any resistance. That becomes a little bit more of an endurance exercise. So if you don't have a band, that's totally okay. You can do like this, or what might also get a muscle pretty close to that is if we are in our side, bringing that knee up a little bit more and bringing your leg forward, and then lifting up and down so that we're feeling that hip muscle, that glute muscle back through here. Really important for stabilization, especially that SI joint, that low back. And these muscles, your glute muscles, are really important because with pregnancy, those muscles get shut down just because of that posture. So your core gets a little bit weaker. That posture, that tilt that happens during pregnancy, your pelvis kind of rotates forward, so those glutes don't get to turn on as well. So making sure you're really strengthening and focusing on those glutes and that postpartum, especially that immediate postpartum before you really start doing a lot more exercising, is really beneficial. Okay, so how do you progress once you're cleared by your OB? So you make it to 6 weeks or 8 weeks, your OB says, go ahead, you can start exercising again. So what does that mean? Could mean a lot of things, but basically similar to any return to exercise, any return to sport, you're going to progress slowly, you're going to increase gradually. So, you know, setting those realistic expectations that you're not going to just jump back into what you were doing before you got pregnant. You know, it's definitely going to take some time to get back to that pre-pregnancy level. So I think just having that realistic expectation can be helpful, just to make sure that you're not beating yourself up of like, well, I had a baby, but like, why am I not back to what I was doing? So just keep that in mind. In different ways, there are different ways that you can progress and increase gradually. So depending on what your goal is, you know, if you're trying to get back to running, and we'll go over this a little bit more, but, you know, maybe you increase distance, maybe you increase time, or pace. You know, you choose one of the 3 components before you start to add the other ones and kind of test to see how you do. So you want to make sure you're avoiding excessive fatigue and dehydration. Fatigue can increase your risk of injury, so you just want to make sure you're getting enough rest. Obviously, some nights you might not get enough rest. Others you may luck out and have, you know, more sleep. But just making sure that you're not so fatigued that you're going to hurt yourself. Making sure that you have good support for the abdomen and breasts. So making sure you invest in a really good sports bra. And then I would suggest working with the physical therapist. I'm biased, but, you know, either a pelvic floor therapist or a therapist who has a lot of experience working with that postpartum group is a great way to make sure that you're progressing appropriately to reach your exercise goals. So one of the big things is like, how do you know you're ready for higher level activities like running? Sometimes I don't think I don't think there's always like guidelines. I think it's, you know, okay, this exercise is now really easy. Like, I think I can definitely progress this. So if we're talking about returning to lifting, you know, you want to increase that load or resistance progressively and slowly. So, you know, maybe you do 8 sets or 8 repetitions for 3 sets of an exercise with 5-pound weights. And then, you know, the next time you do maybe a couple more reps, but you still keep that same weight. That, you know, you can either adjust weight or maybe you adjust the sets and reps. But the biggest thing I would say is avoiding a Valsalva maneuver, which if you look at this picture, she is 100% doing a Valsalva maneuver. So that's basically like strong bearing down, like her face is turning red. She's bulging down on that pelvic floor. So she is not using that pelvic floor to stabilize at all. She might be using her abdominals. She looks like she has a belt too to help her. So, but that's something that I would avoid. I definitely would recommend avoiding that. You want to use your pelvic floor and have those muscles support you, because otherwise you're risking urinary incontinence, pelvic organ prolapse, back pain, you know, maybe a disc issue. So another big thing is using moderate to slow speed with control, especially in that beginning. I didn't really mention, but in that beginning time period where you're starting to exercise, it's so important to make sure you have good pelvic control, that you're using your muscles in that kind of fashion to make sure that you're not risking injury. And again, like if you're not using control, you're just going to increase that risk for injury, you know, like that's how a lot of back issues or back strains happen. So allowing enough time to recover in between workouts. So if you're doing exercising a certain group of muscles, maybe 2 to 3 times a week, making sure you're leaving at least a day of rest in between. And depending how sore you are, you might need a little bit more time to recover in between, and making sure you're doing the right things to recover in between, you know, maybe some foam rolling, using a lacrosse ball, stretching, things like that, yoga. And then with any exercise, should always be pain-free. Pain is your body's way of saying something is not right. So making sure that any movement that you're doing is pain-free. If you know, back off and it's still painful, PT is a great option to help get you to, you know, reaching your goals. So, okay. Returning to higher impact activities. So I'm talking mostly about running. If anyone has something specific that they want to ask about, I'm happy to answer any questions about that. But so running is basically jumping. So with that, there's a sudden rise in intra-abdominal pressure. So I mentioned before that pelvic floor helps to resist that intra-abdominal pressure. So we need good pelvic floor control. We need good abdominal support to prevent any kind of disruption of that. So, because otherwise, again, we're leading to pelvic floor dysfunction, low back pain, things like that. So if you look online, there's a ton of return to run programs. So one that I know of is like Couch to 5K. So essentially you're looking at running intervals. So running for maybe 30 seconds to start, and then, you know, walking for 90 seconds, or some programs, you know, maybe will have you run a minute and then walk 4 minutes. And they usually have you do that up until 30 minutes. So depending on what your goal is in terms of distance running. So definitely I would look into that if your goal is to return to running. And then there's a few kind of tests that PTs will use to assess your ability to return to running. So returning to running, I mean, there's a lot of, you need a lot of muscle strength and core stability. You need good balance because it is a single leg activity. Some of the things that I would consider, I definitely would say, like, you should be able to walk for 30 minutes. You know, if you're huffing and puffing with 30 minutes, you're probably not ready cardiovascularly to return to running. So making sure that you can get up to that time would be a good test. Being able to balance on one leg for 20 seconds, being able to do a single leg squat, hopping in place, jogging in place. Those are good ways to test to see, especially if you think you might have any pelvic floor issues. You know, do you leak with that? Do you have pain with that? That's a good test to do before you go out running. Side plank, making sure you have good abdominal strength, hip strength. You need good kind of side of the abdomen, hips. You need good strength there to help make sure that your pelvis stays balanced. Just makes running so much easier. And then doing a bridge with the straight leg raise. So basically you're doing a single leg bridge, keeping your one leg out. And can you hold that for 30 seconds without fatiguing, making sure you're not feeling that in your back, your pelvis isn't dropping to one side. So those would be some things that I would maybe use as a test to make sure that you know that you're ready to return to running. And I mean, you know, worst case scenario, you try running and you have pain. That would be a big thing that I would say. If you have pain, you're not ready to run. So, all right. So kind of going into that, some signs to look for that you're overdoing it. Any pelvic heaviness or bulging. So this is an indicator usually for any pelvic organ prolapse. Basically, didn't really mention, but a pelvic organ prolapse, your pelvic organs are kind of descending down into the pelvic bowl. So kind of down towards the vaginal opening. So sometimes feels like maybe a tampon's coming out, or there's like pressure in the vagina. That's a sign of prolapse. If you're leaking urine or have an inability to control bowel movements, you know, sign that you're not using your abdominals properly, you're not using your pelvic floor properly. Pelvic pain or low back pain, again, pain is your body's way of signaling that something's not right. So don't ignore it. You want to address that as soon as you can. To treat something that's acute, so if you just are experiencing it, it's so much easier. It takes much less time to address it than when it becomes chronic. So definitely use that as your guide. Any onset of vaginal bleeding past 8 weeks that's not associated with your period, that is definitely one that if you're experiencing that, I'd reach out to your OB or your gynecologist, make sure nothing else is going on. And then any excessive fatigue, make sure you're not overdoing it. Just you want to progress slowly. And again, make sure you're just risking, make sure you're avoiding risk of injury as well. So these are a lot of things that kind of the most common reasons that a new mom might tell me that they did not exercise, and these are very valid reasons of reasons not to exercise. So, you know, time, your time definitely becomes more limited to just spend on yourself. You're focusing on a new baby and potentially other children, you know, and especially, you know, maybe after 6 weeks or, you know, whenever you decide to go back to work. So you're balancing work schedule, baby schedule, your own schedule, big barrier, fatigue. So not getting good nights of sleep, you know, maybe you're again working, you know, there's a lot going on, and then access to childcare while, in order for you to exercise is also another barrier that some women have reported. And, you know, a general tip that I would recommend is just one, incorporating exercise wherever you can. So if you have a free 5 minutes, try to knock out 2 exercises, you know, maybe doing a bridge, depending on where you're at in your recovery, doing a bridge, doing a squat. Try to engage or try to involve your baby too. So if you're doing a squat, you know, holding your baby, you know, they probably would have fun doing that. putting them on your hips to do a bridge. So it's good resistance for you. You don't have to find other weight to add, but, and then they have fun too. Or like in this picture, you know, this woman's doing, looks like she's doing a push-up and going to kiss the baby. That would be a great way to just kind of knock out some of those reasons. You know, you're fatigued, you know, before you go to bed, try to do an exercise. I always think that something is better than nothing, just to get those muscles working. You have a free moment before anyone wakes up in the morning, take that time to you know, do an exercise or two. All right, so that is it for my presentation. So I'm going to stop sharing my screen. My contact information is here. This is the Lakeshore East Clinic phone number. So if anyone has questions or you know, think that they might benefit from some pelvic floor PT, you can definitely give us a call, or you can email me directly if you have other questions for me. So I'm going to stop sharing and see if anyone has any questions. Hopefully this was a beneficial session for you, that for those of you who joined. Can be kind of intimidating, especially there's just not a lot of information out there of where to start. And I think, you know, the biggest thing would just be progressing slowly and setting those realistic expectations. Does anyone have any questions or want to review any exercises specifically that they, you know, have in mind? I'll leave the chat open for a minute or so. If not, this presentation should be available. Oh, here's a question. Any poses or anything in yoga that should be avoided when getting back into it? I had a regular yoga practice before pregnancy and during. So yeah, great question. So I would say, how far postpartum are you? I'm assuming you had your baby. Because so depending, so any position, like, so if you 5 weeks, okay. So I would just use all those symptoms or those kind of guidelines as your frame, to just your guide. So like, you know, any pain, anything like that. I would say like the biggest thing that I think of is if you have like a diastasis rectus, so if you have an abdominal separation, which you're still 5 weeks, so those abdominal muscles still might have a little bit of a separation. The big things that I would avoid are any kind of jackknife exercise, so anything that you're really kind of flexing that abdomen. So you know, not that you're doing sit-ups in yoga necessarily, but anything that kind of mimics that motion, that would probably be the biggest thing that I would avoid. I think most other positions should be okay. Plank, any plank pose, that might be one too that you maybe modify in the beginning until you feel like your abdominal muscles are really starting to engage a little bit more. That probably would be the only other one that I would maybe modify. And you can maybe modify, like if you're doing it at home, you know, maybe doing it to like your bed or like a countertop, just to start off with. But I think those would probably be the biggest two types of positions. Specific poses, I'm not sure, but basically anything that would mimic that range. Great question. You're welcome. Any other questions? Again, you can feel free to email me if you have other specific questions. I'd be happy to chat, or we could always set up like a free injury screen too. If you know, you're not really sure where to start, we can definitely do that. But otherwise, I think it seems like everyone else is good here. So thank you so much for attending. Hopefully it was beneficial for you. and hopefully you guys recover well and have a great postpartum period. So, all right, bye guys.